Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today our topic will be the general discussion about a field called as orthopedic surgery. We'll be briefly discussing how in orthopedic surgery, what different type of planning is actually utilized as the orthopedic surgery deals with the musculoskeletal disorders, and what are the different preparation and planning and equipments which is needed to do an orthopedic surgery like nailing, plating, or even hip or knee replacements. Then in the second section, we will be going through intraoperative radiography. What are the different techniques are being utilized to make the diagnosis, especially like X-rays, CT scan and MRI, and what is the indications and contraindications to these investigations, and how how the orthopedic surgeons with their clinical history and examination get aid of these techniques, or especially intraoperative radiography, so that they can perform the surgery in best possible manner. In the third section, we will be briefly going through some of the operative procedures, such as why a bloodless field is needed, especially when we are dealing with area of the bone which is actually a living tissue and it requires blood, and usually is actually richly supplied by the blood, especially through the periosteum. Why insagination and tourniquet pressure is important, and what are the different complications which can occur when excessive pressure at tourniquet or eschmarring is being done. Then we will briefly discuss what are the measures to reduce the risk of infections. Nowadays, it's the underlying, this is almost the percentage of infection is way less than 1%, and almost the standard of care is actually bloodless, infectionless surgery, and that is what everybody is now aiming towards throughout the world. In the fourth section, we will be briefly going through the thromboprophylaxis. We will be discussing deep vein thrombosis and pulmonary embolism, how they can be reduced, what were the procedure which put patient at increased risk of DVT and PE. And lastly, we'll be going through the limb length equalization, that is limb length discrepancies which we may need equalization. Usually there are multiple congenital causes, there could be traumatic causes, or there could be paralytic causes such as CP, polio, and these children may have eventually a gross limb length discrepancy may as large as 5 centimeter, 10 centimeter, 15 centimeter. So how they can be managed initially, what are the procedures by which we can calculate how much LLD or limb length discrepancy would eventually this child would have, and what are the procedures to deal with it? What are the procedures which can be done on the normal limb, such as shortening of the normal limb or epiphysiodesis? What are the procedures which can be done on the involved limb, that is, which is a shorter limb, that such as limb lengthening? Keep watching sqadia.com. Thank you very much.